Hello, everyone. It is 7 o'clock, and thank you so much for joining us this evening. My name is Dr. Rebecca Kellum, and I am an assistant professor of pediatrics with former public school pediatric OT experience. Tonight's hot topic is really exciting. Is understanding interoception, evaluation tools, and neuromodulation-based OT strategies. And we are honored to have Dr. Jennifer Newman as our guest speaker tonight. Dr. Newman earned her OTD from Bay Path University with a focus in autism studies and has 8 years of experience in pediatric occupational therapy. Her scholarship centers on interoception, including the development of an interoceptive awareness protocol and a continuing education course to advance OT's knowledge in this area. Before we begin, I'd like to just briefly orient everyone to Zoom. If you move your cursor on the screen, you will see a view option in the top right corner. Please select presenter view rather than gallery view so you can view the slides alongside Jennifer's video for the best viewing experience. Throughout the presentation, feel free to submit your questions in the chat. I'll be checking those frequently, and we'll also have time at the end for our Q&A. So let's get started, and please help me welcoming Dr. Jennifer Newman. Welcome, Dr. Jennifer Newman. You can go ahead and share your screen. I'm going to stop the share.
Awesome. Okay. Thank you everyone for being here. I'm really excited to share on my topic tonight. As Dr. Kellum explained, it's going to be on interoception, and I'm going to touch on evaluation tools and neuromodulation-based strategies. So thank you all for being here. So first, I'm going to start by going over the learning objectives and the information I hope that you'll walk away with the presentation having learned, an overview of what interoception is and how it affects us in our daily lives. I'm going to touch on a few of the common diagnoses that are associated with interoceptive difficulties. And then I'm going to discuss some different evaluation methods that we can use to determine when an individual is having some trouble in this area. And then I'm going to discuss evidence-based intervention approaches, which use the neuromodulation techniques to support growing in the interoception skills. I'll give a little summary, and then I'm going to open it up for questions at the end. So my hope is that you walk away from this presentation having learned and being able to define what interoception is and to be able to describe its role in our daily lives and maybe the ways that it impacts some of the individuals we might be working with. To explain how interoceptive awareness may be impacted in common diagnoses. To identify signs of interoceptive awareness difficulties. To describe different methods used to evaluate interoceptive awareness, which can include observation, self-report measures, and functional assessment approaches. And lastly, to demonstrate understanding of how to use the neuromodulation-based interventions that support interoceptive awareness, which can include body scans and interactive sensory activities. And just as a disclaimer, I am a pediatric occupational therapist, so I'm going to often refer to patients as students or children, but the information here can be applied to all ages, but I often catch myself saying student, so you can kind of insert patient or client whenever I say student. So interoception is often referred to as the eighth sensory system, and the interoceptive processing centers in the brain are located in the insular and the frontotemporal regions of the brain. Interoception allows us to interpret internal visceral sensations as body states. It's the system that alerts us to basic bodily needs, which can include hunger, thirst, temperature, pain, itch, muscle tension, sexual arousal, and visceral sensations of bladder or bowel fullness. This is an internal sensory system in which the internal physical and emotional states of the body are noticed, recognized, and then responded to. So our interoception skills are required for a range of basic and more advanced functions. From knowing when you feel itchy to knowing when you need to use the restroom and being aware that you are becoming angry or upset, and then being able to manage your emotions proactively. When individuals have not yet developed interoception skills, they can struggle with not only their own emotions, but with social interactions and trying to understand the emotions of individuals around them. It can be really difficult for someone with interoceptive difficulties to move through their day-to-day activities, especially if they're unable to understand when they feel thirsty, when they need to use the restroom. And research also finds that children and young people with well-developed interoception are able to use both logic and emotions to respond to their environment, whereas those without interoception skills tend to rely on logic alone, and they have to carefully think through their possible responses to every single social situation. And thinking through these situations can really lead to overload, shutdown, meltdowns, anxiety, and depression. So I find that interoception is really important in emotional regulation skills and social skills. It's a really foundational base to kind of interacting with others because you first need to understand how your body is feeling in a situation in order to be able to then react in a situation with other people's bodies. Without interoception, it's also not possible for individuals to develop metacognitive abilities. So, research has identified links between metacognition, which is the ability to think about thinking, so that higher order thinking, social emotional intelligence, and interoception. So, all of these skills really build upon each other, and we use all three to do those complex metacognitive tasks. Interception can also be defined as mindful body awareness. So, someone who is skilled in interoception can, for example, tell when their heartbeat is beating fast, that it's signaling fear versus excitement, because they can notice and identify all of the other internal signals that they are experiencing to help them process and respond to their overall emotional state. So, when your heart's beating really fast, paying attention to the other sensations in your body help you to identify if you're feeling angry or if you're feeling happily excited for the situation that's occurring. And then on a more basic level, interoception also enables people to know when they are thirsty or experiencing muscle tiredness. So interoceptive difficulties can impact an individual's wellness and overall health. For example, if you're unable to determine when your muscles feel tired or you need to take a break, it can really impact the way that you engage in physical activity, and your overall health if you're not drinking enough water or eating food when your body needs it. Deficits in interoception can impact self-care occupations, emotional regulation, and participation in daily occupations in social skills, schools, work, pretty much across the board. Thankfully, occupational therapists possess a very unique skill set for addressing interoceptive differences. Our scope of practice in the field of sensory processing was established in a position paper presented in 1982, which asserts that our unique skill set in addressing sensory processing includes evaluation and intervention. So OTs really have the skill set that to address this area of need, and it's very exciting. Some common diagnoses that are associated with interoceptive difficulties include sensory processing disorder, autism spectrum disorder, anxiety disorder, depression, attention deficit hyperactivity disorder, chronic fatigue, and eating disorders. So, a lot of research has been trying to link interoceptive difficulties with common diagnoses. And so these are the ones that have been found in research to have a link between a high prognosis of interoceptive deficits if an individual also has one of these diagnoses. And these are also really common diagnoses that we work with every day in occupational therapy across settings. So when you're working with someone who might be diagnosed with one of these or who might mention, difficulties with different sensory systems, it could be really helpful to give a little questionnaire about some interoceptive questions, and see if you need to really dive deeper into that evaluation and see if interoception is impacting an individual's participation in their occupations. Interoception consists of three measurable processes. So before we get into how to evaluate for interoceptive difficulties, it's important to first understand the areas in which interoception can be impacted. So there's kind of three steps to the overall sensation of interoception. The first is what is called interoceptive accuracy. And this is the objective ability to accurately detect your internal bodily signals. So the question that can be asked in this process is how objectively correct are you? It can be measured through behavioral tasks such as heartbeat counting, heartbeat discrimination, and gastric sensitivity tasks. So a lot of the first interoceptive research articles really researched on how to find what interoceptive accuracy was using a lot of these heartbeat counting and gastric sensitivity tasks. So I don't use those in OT practice, but if you read a lot of research on interoception, those are the most commonly used objective assessments. An example of interoceptive accuracy is if your heart beats 60 times and you correctly report that your heart was beating 60 times in that time frame, that means you have a high interoceptive accuracy. And this process, it's performance-based and it reflects the physiological signal detection. So it's the most objective out of all three. The second process is interoceptive sensibility. And this is your self-reported belief or your perceived tendency to notice internal body sensations. So the question that can be asked in this area is, how aware do you think you are? It is often measured through self-report questionnaires. Some of those include the Multidimensional Assessment of Interoceptive Awareness, or the MAIA, or the Body Perception Questionnaire, the BPQ. So I'll go over what both of those are in the next slide. But for interoceptive sensibility, it's when you're able to say, I'm very aware when my heart rate is racing. It's a personal belief, it's very subjective. Regardless or whether you're right or not, it's just measuring how accurate you believe yourself to be. And then the third process is interoceptive awareness. And this is the metacognitive awareness of your interoceptive accuracy. So, how well your confidence matches your actual performance. Do you know when you're right or wrong? So, this reflects your insight into your bodily perception ability, and it's measured by comparing your accuracy scores with your confidence ratings. So, for example, if you accurately detect that your heart rate beats 60 beats per minute, but then you also answered a questionnaire where you correctly judge that you are good at understanding your heartbeat rate, then you have high interoceptive awareness. And an important note here is that in occupational therapy practice and research, the word interoceptive awareness is used interchangeably with interoception. So they interoceptive awareness questionnaires kind of like ask questions across all three processes and kind of ask questions to get the entire picture of interoception. So the words are often used interchangeably, just as a heads up. There are multiple methods for evaluating interoceptive difficulties, and occupational therapists can use family and patient interviews. They can use observations, and they can use self-report questionnaires. For a well-rounded and accurate evaluation, a combination of all three methods is very helpful. Questionnaires are subjective, so an individual's interpretation of the Likert scale also can vary, as well as cultural and past experiences can really impact how someone responds to one of the questionnaires. Two people that are experiencing the same exact situation may score an item differently based on their perception of what the term frequently versus the term occasionally mean. And additionally, if you ask a caregiver or a teacher to fill out a questionnaire, that might not capture the entirety of the individual's sensory experience. So therefore, I really do like to use these assessments tools as a guide to really identify areas that might need increased observation or increased interviews, areas that I can also kind of dive deeper into and have a deeper discussion with the patient or the individual. I also use the self-report questionnaires to identify areas of need that to support the individual. That's why it's really important not to rely on just one assessment method, but to include all three, the interviews, observations, and the standardized measures. In this chart, I've listed the interceptive evaluation tools that are most often used in research and in practice. Some of them are available currently for use, and others remain in the research process, awaiting finalized standardization. So I'm going to go over the current tools that are available. The first is the Multidimensional Assessment of Interoceptive Awareness 2, the MAIA. This tool is currently used for individuals aged 18 and older. It's a self-report questionnaire, and it asks questions about different facets of interoceptive awareness, such as noticing the body signals, noticing emotional states, self-regulation, body listening, and trusting. So the trusting is like confidence ratings. How well can I trust myself to know when I feel a certain way? This measure is standardized and you can purchase it and use it in practice, and it also is used frequently in research. The MAIA also created a youth version, so they created one for individuals aged 7 to 17. Again, it is self-report, and they adapted the questions from the MAIA to be more child-focused and more child occupation based. This one is also available to be purchased and used in practice, and it's also used in research. And I did want to note this is the youngest of all of the questionnaires. And it is aged for age 17, and that's because it is a self-report. So a lot of the skills that an individual would need to be aware enough of their bodies and to understand enough of the language to be able to complete a self-report questionnaire. It wouldn't really be useful for anyone under 7 because they might not be able to answer the questions in a reliable way. But if you're working with a child that is younger than that, you can use these self-report questionnaires as a guide to kind of more as an interview tool and kind of like use it as a stepping stone of like which questions to ask and kind of get more information that way. The third test is the Interoception Sensory Questionnaire, or the ISQ. This one is currently aged for adolescents to adults, age 13 plus, also a self-report. And it asks very similar questions to the MAIA, but it asks more about hunger, thirst, and bodily cues. And this one so far is only used in research, but you can contact the authors and get an on-standardized form that you can use in practice. So I have used this one, and I do really enjoy the questions that this form uses, and it's in the process of becoming standardized and hopefully will be available for use, clinical use soon. The next one is Body Perception Questionnaire, or the BPQ. This one is also for adolescents and adults. There's two separate forms. Again, self-report and very similar questions as the rest. And this one can also be purchased and used in clinic, and is also used in a lot of the research articles. The next one is sensory profile interoception scale. So I'm sure we're all familiar with the sensory profile. That's a really common sensory processing assessment measure. Those authors and creators have now created a separate interoception scale, so kind of like a supplement to go along with the sensory profile. This one is aged for adolescents and adults, 18 plus. It is self-report and it does have a behavioral or observational section also attached to it. And to go along with the sensory profile, it asks questions in like sensitivity, so like aversion to different sensations, avoidance, and low registration. So it kind of follows the vocabulary that's used in the regular sensory profile. This one is also in the process of becoming standardized. So you can contact the authors and request to use it informally. I have used it and it is really great. I like it again as an interview tool, and I'm really excited for it to become standardized and to really fit into what the rest of the sensory profile. It's a great supplement. And it'll also give you a really full picture then of the full sensory processing, which will be very exciting to use in practice. So keep your eyes out for any research about that one. And then lastly is the Interoception Assessment Bundle, the CAIA3. So this is an entire like clinical toolkit. There's one for children, adolescents, and adults. It has a structured self-report questionnaire, but it also includes step-by-step intervention tools as well. So this one you can purchase as the full kit and kind of it goes from eval to intervention to discharge. I wanted to just give a few examples of what these assessment tools look like. So the first tool that I chose to look at is the MAIA. This tool has 8 scales and a total of 32 items or 32 questions. And again, it measures the interpretation of body states and dimensions of interoception. In research, it has received good internal consistency, reliability, and validity. And as you can see in the example here, it asks individuals to rate themselves on a scale of 0, meaning never, to 5, meaning always. And some of the questions that it asks include, when I am tense, I notice where the tension is located in my body. I notice when I am uncomfortable in my body. I notice where in my body I am uncomfortable. I notice changes in my breathing, such as whether it slows down or speeds up. And an important note here, sometimes when I'm working with some younger students who might have a really hard time kind of understanding what the words mean, like if they don't understand what tension means, I might give them examples. I might describe times when I feel that way, and so that helps them to think of times when they might feel that way. And again, I use it in sometimes as an on-standardized tool just to interview the students and have questions that I can then dive deeper into and find areas that we really need to work on. The second example is the Interoception Sensory Questionnaire. So this is the one that is still in the process of becoming fully standardized. It has 20 items and it measures the interpretation of body states. And so far, research has found that it has a high internal reliability and validity. And in some of the research articles that I included in the references, it is used with individuals diagnosed with autism spectrum disorder. So they have really altered their language to really incorporate that diagnosis and incorporate situations that are common areas of concern for autism spectrum disorder. A few of the questions, and this one also asks individuals to self-report on a Likert scale of never, frequently, occasionally, always. Um, and so some of the questions on the ISQ they ask include, I have difficulty feeling my bodily need for food. I'm not sure how my body feels when it's a hot day. I find it difficult to describe feelings like hunger, thirst, hot, or cold. So you can see that these two assessment tools, they are asking about very similar body states, but they ask it in very unique ways. So it's important when you're looking at evaluation tools to kind of look at all of the questions and see which tool uses language and experiences that best fit the needs of the client that you're working with. And so I find that the language in the ISQ really works well with the students that I'm working with. It asks questions in a way that's really easy for them to understand. So, for example, all of my students know what it about, like they love to eat lunch, so they understand like the way this question is phrased, and they know about what a hot day means. They know the sun is out, so it's just phrased in a way that's really easy for them to understand. Before we move into the intervention section, I wanted to talk about one of the practice models that I use when I'm working with interoception with the students that I work with. So the sensory integration model, it's a theory and intervention framework that explains how the body organizes sensory information to support participation in daily life. It is foundational therapy, especially in the pediatric practice. And it asserts that the brain must effectively receive, organize, and then integrate sensory input from the body and the environment in order to produce an adaptive response. And so, an adaptive response is a successful, goal-directed response to a sensory experience. So, for example, adjusting my balance when I step onto uneven ground is an example of adaptive response. So, my body is taking in all of the sensory input that my foot, my eyes, my proprioceptive receptors are feeling when I'm on an uneven surface and helping my body to adjust the balance to meet that uneven surface ground, that input. And the sensory integration model, when this process works well, when we are able to receive this sensory input, register it, integrate it, and then have an adaptive response, we move, we learn, we regulate emotions, and we participate in our occupations. But when it doesn't, when one of these areas is not working the way we want it to, it can really impact our participation, our behavior, and our regulation. Um, so the sensory integration model of occupational therapy practice, it aligns well with the neuromodulation interventions that I'm going to discuss using those mindfulness techniques. Um, this theory postulates that addressing the central nervous system through sensory processing needs can support individuals in learning adaptive responses within their current environment to promote functional outcomes. Sensory integration theory guides the implementation of strategies such as using the body scan and using the somatic activities or experiments, as I refer to them, to elicit sensory responses and support the functional processing and outcomes. And this is also a really great theory because it does highlight the individual's environment. And so when I talk about the somatic activities and experiments, I talk a lot about the environment that the individual is in. So it's really important to kind of meet the client, the student, the person we're working with in their current situation. And I find that the sensory integration model accounts for that. So some of the evidence-based intervention approaches for interoception includes the use of neuromodulation. Neuromodulation, it's an evidence-based intervention. It's also referred to as mindfulness, and research supports its efficacy in altering the neural pathways in the insular cortex, which is the area that processes those visceral body states, the interoception. And basically, what this is it's a mindful attention to our body sensations and signals, and a rewiring or a change in our understanding of what those sensations identify in terms of body states. So, an individual who's having difficulty with interoception might not be picking up on the sensations or signals in their body. They might not be aware of it, or they might be mislabeling them. And so having this really specific mindful attention on those specific body sensations really helps to educate them on paying attention to that, identifying it, labeling it, and then putting those sensations together to make sense of the current body state. And as a reminder, body state could be thirst, hunger, anger, the need to use the restroom, so forth. And so the body scan, it's a research supported and commonly used tool in OT practice, and it involves the systematic examination of body signals using verbal and visual cues to guide the individual. So the body scan can include starting at, say, the head. What sensations do you see with your eyes? What body signals is your nose getting? What do you smell? And then it can also move on to muscles. What are the muscles in my arms feeling? What's the skin on my hand feeling? So the body scan is just paying very close attention to one specific body part, at a time. The body scan by itself is not super effective. It needs to be combined with education and somatic activities. So the education on what body signals elicit which body state is really important. So the sensations that let me know I need to use the restroom could be that my visceral sensations inside. I feel tight. I feel like my body feels a little bit warmer. These are the sensations that let me know that I need to use the restroom. So educating your client, your student on which sensations I need to be paying attention to and what those sensations lead to is really important. I like to use a lot of visuals and do some. When we get to the body scan, you'll see the visual of like basic anatomy. But so, for example, if we're working on identifying the need to use the restroom, I like to provide education and a visual on what the body looks like and where my food and water kind of travel through the body. So I'll educate when I eat my food, I eat it in my mouth, and then it goes down my esophagus into my stomach. And it's really hard sometimes for individuals to visualize what that looks like because we can't see inside ourselves. So having a visual of those of the pathway of food really helps individuals to then be able to attend to, oh, okay, so my stomach is around here. That is what I need to be feeling. And the reason that I can feel hunger is because that's part of the food pathway. So it just really helps to add visuals and education when we're teaching individuals to pay attention to these sensations. And then an interoceptive somatic activity, I also call them experiments. This focuses on creating and noticing a change in some aspect of one's internal self, such as one's muscular system, breathing, temperature, pulse, or touch. So, for example, people with atypical interoception may not be able to identify the physiological changes that signal mood changes or bodily self-regulation needs. So interoception activities can teach us to connect with these signals. An interoception activity focuses on a particular part of the body for at least 30 seconds, and it enables a change to occur in one's body state while labeling that change. So an example of a somatic activity, maybe we're focusing on temperature and skin. I could have an individual hold an ice cube, and we can ask, what does my hand feel like before I hold the ice cube? What does it feel like now? Now it's wet and now it's cold. So the somatic activity or the experiment is adding a specific sensation to the body while the individual is paying attention to that one specific body part for at least 30 seconds and then removing that sensation and being able to label it. And it is really important to repeat the same activity, maybe a second time, a couple times, so that the person you're working with can get a chance to feel what it feels like when that sensation is present and when it's removed. I also find it's really great to do comparison activities. So if I had a student hold the ice cube and we labeled that it feels wet and cold, then I would have us dip our fingertips into warm water and label that that feels wet and warm. So we can kind of compare how those sensations are different. And kind of going from one extreme to the next can really help to elicit those sensations and allow the student you're working with to understand that that's the area of the body that they need to pay attention to. That's what that sensation feels like. Um, and the individual is really encouraged to identify the body state change and label it. And that's where the body scan comes in because it's a really great visual that you can use and you can add labels and like a word box so that they can move those labels to those specific body parts. And I also wanted to note that research has supported that classrooms where interoception is being taught, where they're doing some of these neuromodulation techniques, that they've been found to have decreasing behavioral challenges over the school year. And classrooms where it has not been taught have actually been found to have increasing behavioral changes or static changes. And that's because individuals who are learning interoception are learning how to and connect to and understand their own bodies. And interoception, it's a prerequisite skill for self-management and self-regulation. So it provides children, students, the individual with the tools to know when they are developing emotional reactions and the skills to be in control of those reactions. So without interoception, social skills are just the application of rules, and it's not really a meaningful way of interacting. But when we add this interoception and we add the ability to understand like our emotions and to regulate them, it enables the student to develop a deeper sense of belonging in that social situation. And so it's very exciting to see that these evidence-based approaches are working as OTs are implementing them in schools, outpatient settings, and at home. So the somatic activities, I wanted to give an example of some of the activities that you can use. Children, young people, individuals, they can learn a range of appropriate responses once they're able to notice and recognize the internal signals. So, for example, a child or young person who runs out of the classroom on a daily basis, they might be reacting to external sensory input that they find extremely distressing or upsetting. But without an awareness of what being distressed feels like, they're unable to recognize that they are distressed, and therefore they might not actually realize that the sensory input is problematic for them. So, for example, if a student runs out of the classroom every time a very specific morning song comes on, we might think it's behavioral, but it could just be they're reacting to the auditory or visual sensations that are going on around them, but they're having trouble connecting what emotion they're feeling and why they're feeling it. So once a person can, understand these signals, can begin to work on regulating those emotions. And so I just wanted to give an example of like some of the really foundational skills. So before we can work on the bigger emotional regulation, it's really important for individuals just to be able to recognize and identify the sensations that lead up to those emotional states. So a really good place to start is with the auditory system and with temperature. So some activities or somatic activities experiments that you can do include listening to music. So you could have a song on that is really meditative and quiet, really few instruments, and have the student identify, the volume of the music, what they hear. And you can even ask them how it makes them feel. And then you could play a song that is like a really high beat, lots of instruments, really loud, and ask kind of the same questions. And this is just really helping, again, to identify those foundational skills. What are some sensations that my body takes in, and how can I label those? So I'm going to label when things feel loud. I'm going to label when, there's a lot of different noises at once, and I'm going to label how it makes me feel. So maybe after they listen to the really loud, high beat song, you could ask also, how's your heart feeling? Is your heart rate increasing? And kind of connect different body sensations to that as well. And then also temperature. So I kind of talked about the ice and the hot water. That's a really good experiment or activity to do. You can also do a lot of environmental ones. So even just standing outside, say it's a windy day or it's snowing, you can ask, well, what temperature is that when I put the snowflake on my hand? How does that feel? If the wind is blowing, does it feel cold on my face? Where can I feel it blowing? Like if I close my eyes, can I feel the wind on my face? Can I feel it on my hands? When the sun is shining, does that feel warm? Does that feel cold? And so we don't want them to just learn that the sun means hot. We want them to really like give them a chance to experience that sensation and then give them a chance to label it. And so these are two really great areas to start in as those foundational skills, and then keep building up and adding different body parts or body sensations. So another one you can build upon is our muscles. And our energy levels. That's a visceral sensation interpreted by interoception. So you could have a student do things like wall squats, push-ups, running, jumping jacks, and we can ask them to complete the body scan before and after. So before we do all of this activity, maybe my muscles are feeling really loose. We could even talk about our skin. My skin feels dry because I'm not sweating. My muscles maybe feel a little heavy. Maybe I'm feeling tired. And then after I do the physical activity, I come back and I reassess how are my muscles feeling? Oh, maybe they feel really tight, or maybe that physical activity helped to loosen them up. Maybe my skin feels wet because I'm sweating. And again, you could ask about the heart rate. Before I start my physical activity, my heart rate is low and I feel calm. After I do my physical activity, my heart rate has increased, and I feel energized. So it's really important to do lots of different activities to really help the student you're working with or the individual you're working with to be able to experience these sensations across numerous different activities to really give them a chance to feel what the muscle tension and energy levels feel like. And then I gave an example here of like some words that you could include in a word bank. It's really important to ask the individual you're working with for their own vocab because we all describe things differently. But it's also important when we're first working with people who have not had a chance to understand what these sensations feel like, they might need help to come up with words. So I always like to give a word bank and then leave space where then I can write in the individual's words that they give me. So, for example, when I'm working with kids, a lot of times they say that their muscles feel tingly. So I included that word tingly. Maybe you want to call your muscles strong versus loose, sore, tired, heavy. It's not super particular what the word is, as long as that word makes sense to the individual and to the situation that it's being used in. And then after you do some of those foundational activities where you're focusing on just one body part or one body sensation, you can then work on combining a lot of the body sensations together. So for emotional regulation, which is one of the, I would say, more hot topic occupations in interoception, is how it impacts emotional regulation. Once we can kind of understand how our muscles might feel, how our skin might feel, how my eyes or my ears or my face, once I can understand those sensations, then we can educate the student on putting all of those together and what it might look like when we feel angry or upset or nervous. So you can use past emotional experiences, videos, photos, or real-time emotional experiences to help the student to identify how their body's feeling, and to make sense of those sensations, help alert my mind that I'm feeling that certain way. Um, so I always like to model first. So maybe I'll give an example of, oh, today, I dropped my favorite coffee mug and it broke. And I was feeling so angry that I broke this coffee mug. I was already late. I forgot my lunch, like all of these things, and I'm so angry when I get to work. And so I know that I'm angry because my muscles are feeling really tight. My body's feeling warm. My heart rate is increased. My jaw is clenched. I can feel that my ears aren't, I hear a little ringing in my ears. So I put all of these sensations together, and I know that that is when I feel angry. And so, as we know, anger can feel different depending on the person. So it's really important that we have them again to have the student again take their time to really focus on individual parts of their body and label how it might feel. And so we can kind of use examples like play a video or show a photo of someone who's angry and then talk about a time ask the student, when did you feel angry? Let's talk about a time when you felt angry. Do you remember how your body was feeling, how your muscles were feeling? And just help them to really pay attention to the areas of the body that alert us to that emotional state of anger. Um, and then these activities, they are going to be very challenging. And so I don't recommend you working on big emotions during times when those big emotions are happening. If we notice signs that a student is becoming upset or becoming angry in the very early stages, maybe we could have them do a body check. That could be a good time to kind of call attention to how their body's feeling and then maybe help them to realize, oh, I know you told me when I feel angry, this is how my muscles feel. Maybe it's time we take a break and we can use one of our break visuals. So just a nice little tip there that I think we can use current emotions, but be careful of using current big emotions because that's not a great time for anyone to kind of take in information and to learn and then process what's going on. Um, oh, and I also wanted to talk about so we can also help kids to feel how they're feeling angry with then having them feel the opposite. So one example that I like to do with kids, it's called volcano breathing. So it combines, deep breathing with visual imagery and movement, which is, I find, especially effective for young children. So to do the volcano breathing, you kind of bring your hands together at your chest, and then you slowly inhale while you raise your arms overhead. You pause briefly at the top, and then you exhale slowly, bringing your arms back down as if they were lava flowing down the volcano. And so this imagery really helps the children to understand that the inhale is energy building and that the exhale is kind of energy releasing safely. So it works as a great coping strategy, but it also works as a really great somatic experiment activity because it activates the parasympathetic nervous system and it slows the heart rate. It reduces muscle tension. And so we can call attention to these sensations and have the students label that. They can label that their muscles feel relaxed and that their heart rate is decreased. And then talk about how, oh, well, when I'm angry, it's kind of the opposite. My muscles are tense and my heart rate is going fast. So you can do, again, the comparative activities of comparing how I feel when I'm angry compared to when I feel calm, so that they can really understand the difference in those sensations in their body. So this is an example of what a body scan can look like. And this is what we include in all of our somatic activities or experiments that we work on. So depending on the individual you're working with and kind of what it depends on what skill they're working on, what their current cognitive abilities are, and that kind of depends on what our body scan is going to look like. So if I'm working with um, a really young student and we just started, I might not want to include all the information that's included on the left side body scan, because I want to first do the education. So I might use a more basic one like the one on the right where I can adjust where our descriptor boxes go. And I do love to use a lot of like whiteboard activities with this, where you can laminate a body scan and use like a whiteboard marker to draw and label different body parts. And you can make it any size so that it's really accessible for the individual you're working with. So, say you're working in the clinic, maybe you make one that can go on the wall of the clinic, or you're working with someone who's at home, you can make one that hangs up on their wall or one that fits on their desk. You can size it to whatever need your individual has, because we really want to encourage the person to do the body scan multiple times a day. That's the only way that we can learn to really focus on the sensations and label, identify, and recognize them is if we're really doing the repetitive practice. And so the one on the right, like I said, could be basic. So the top box, it's pointing to the eyes. So we could say, what do my eyes feel? Is it very bright? Is it very dark? Do my eyes feel heavy? Do they feel alert and open? Um, then we have two boxes pointing to the muscles of the arm and one to the muscles of the leg. So again, some words could be tight, loose, tingly. And then a box in the middle pointing to the stomach. Maybe my stomach feels, I have kids that say grumbly, or my stomach feels hungry, I have a lot of kids say. And so instead of hungry, I'll say, oh, what does hungry mean to you? Like, do you feel it gurgling? Do you feel that it feels kind of empty? So if someone uses a word that you're like, oh, that's the body state, not the sensation, try to get them to keep feeling and keep describing by helping them with some different vocab words. And you could even show, like, I had a student say, I don't know what gurgly means. So I like used some like Orby beads, and I was like, oh, gurgly is like when I move all the beads around and they're all moving really fast. So you can also do some examples of what these vocab words mean and make them really relate to the sensations that someone might feel. And then on the left side, when I was talking about a lot of the education that's necessary, so again, if we're really working on how do I know when I need to use the restroom, a body scan like this can be very helpful because we can show the full process and really have the individual focus on one area at a time. So we focus on my mouth. So maybe we have them swallow a really cold scoop of ice cream, and we have them really focus on trying to follow that cold ice cream all the way down to their stomach, to really call attention to feeling that in that internal visceral organs. So that's a really great somatic activity as well. And then you can have as many labels as you want, but these are some of the labels on the left, like areas where I might have done a somatic activity. So for example, the we did the auditory ears, maybe the nose. You can do different smells and have them label different smells. Our mouth, when I eat something cold versus something hot, when I eat something smooth versus something crunchy. And crunchy snacks are also a great somatic activity to help kids learn like muscle tension too. So if you take a while to crunch on, like say a raw carrot, for example, you can have them pay attention to how their jaw feels. By the end of that, they might feel the tension or the tiredness in the jaw muscles. So kind of going one body part at a time is the ideal. And so there's other experiments that you can do. And I want to call attention to if you go online to Kelly Mahler's website, she has a lot of great interoceptive awareness protocols already available where she goes through each of these body parts and has experiments that you can do with body scans and word banks. So that's a really great website to start with if you kind of want to see what some of these experiments and protocols look like. She has a lot of them already available for you to download and use. And she also has a lot of great, like the body scans and word banks based on the age of the person that you might be working with. And then I just included another example of what your word bank might look like at the bottom. If I am working on one area, so say we're working on just muscles, I would try to limit the word bank to only the words that apply to muscles, and again, leaving some blank space to include the person you're working with, their vocab as well. And then when children or individuals are still developing interoceptive skills, the use of visuals and verbal prompts are really effective support tools because we really want to make sure that they're safe and still getting their needs met. So the area of need up here, say, is still developing bladder and bowel control. We really want to make sure that that individual is safe and socially meeting their social expectations too. So if they're at school and still learning to use the restroom, we might do some visual examples like a toileting icon that's placed near them, also with a regular toileting schedule. And with that toileting schedule is a great place to include our body scan and to have, call attention to how do I feel before I use the restroom? So we can ask them, how do you feel? Do you need to go? Does your bladder feel full? And if they say, I don't know, you could say, let's try. It's on our schedule. Let's just try. And then if they're successful after they're finished, you could then ask them, let's do our body scan. Like, how does your body feel now after you've gone to the restroom? So it's really important to incorporate these visual prompts, but it's also a great opportunity to then incorporate that body scan into like a regular schedule. So I just gave some examples of some other visual prompts that might really help our the individuals we're working with, our students, throughout their day. And so, overall, some of the key takeaway points that I hope you leave with today is that interoceptive difficulties affect a wide range of individuals with a lot of common conditions that we see in the clinic every day. And so, currently, the expected numbers of individuals experiencing sensory processing deficits are between 5 and 16%, which is about 1 in 20. But in the pediatric population, it's about 1 in 6. There's a lot of there's a lot of big area of need here where there might be a lot of interceptive difficulties and deficits that we're just becoming aware of. So it's really important when you're working with individuals to keep that in the back of your mind that, oh, if this individual might have some sensory difficulties, interoception could be a big area of need here. Another important takeaway is that there are self-report questionnaires available, but that we should include questionnaires, interviews, and observations to really evaluate the area of need and where we can support the people we're working with. And lastly, I hope you left with some evidence-based interventions that use the neuromodulation techniques that I discussed, combining the body scan, the somatic activities, and the education. Combining all three of those is a really effective intervention for helping individuals learn interoception and learn how to pay attention to those body sensations. And please don't forget that you should consider the person and the environmental factors when working with people and to make everything individualized. Because when we're working with people with interoception, they might not have deficits across all of the areas. It might just be one or two. So really individualizing our interventions to those areas of need is very important. Thank you all so much for attending the presentation today. I hope you all got some really great ideas from it, and I'd love to open it up to any questions. Also put up my references while we do questions. Okay, I see a question for, do you recommend combining this with a program like Zones of Regulation and or Alert program? It can be combined with zones of regulation. I have used those together, but I will say that if an individual isn't able to recognize what their emotion is, they might have a really hard time even relating to the zones. So I think using interoception first, like the interoception awareness activities and building on that could be great. You can always incorporate when you're talking about the emotions, anger, you could say, oh, this is in the red zone. But I don't think it would be effective to use the zones without first making sure that the person can recognize and identify the emotions that they're feeling. Um, and then how can I modify interoception strategies, such as body scan, for students with significant cognitive delays who are nonverbal? That is a really big area of need. So if you notice, all of the questionnaires had very specific age ranges and they were all self-report. That seems to be the biggest area of need is how do we address this in individuals with lower cognitive abilities? Because you do have to be able to understand that you have different body parts and you have to be able to call attention and mindful attention to each of those body parts. So is a very difficult skill to work on with someone who might have a cognitive delay. Um, I did a 8-week case study intervention with an individual. She was 6 years old, and the a group and I did this interoceptive awareness protocol with her, and we were a little worried that she was too young to understand the body scan and even understand how. So we were trying to help her to feel how to use the restroom, and we were worried that she was too young to even understand how all of that works. But we got her this. Digestive like apron toy where you had like the stomach and the esophagus and the mouth as like Velcro toys. And she was able to understand that. She was also neurotypical and very intelligent for her age. So I actually have not worked with anyone with low cognitive skills on interoception. I think that is an area that really, really does need some more evaluation because due to the higher like level thinking necessary to understand interception, I'm not sure how to relate all of those interventions to that population. Can you explain the volcano breathing technique? Yes, so the volcano breathing, so you kind of have your hands start here, and you can even have like a visual. There's a YouTube video that you can type in volcano breathing. It's a really cool visual that you can have playing as you and the student work on it together. But so you have your hands here, and then you breathe in, and then as you breathe out, you have your hands flow, and you pretend they're lava. And it's just have it really helps to have I always like do a count of four breathe in. We pause for one count and then we breathe out for longer. So making the exhale longer by like 6 seconds. So we count to four up, breathe out for six. That's how I do the volcano breathing. When you are working with your students on interoception, are you doing this more in a small group, RTI individuals? Um, I have worked in two different school districts. The first one I worked in did a lot of the RTI, so it was a lot of push into classrooms and a lot of group work. And the interception somatic activities do work really well in the smaller group setting, or if you have like the teacher paraprofessional supports with you in a larger group. And kids really do love doing them together. And I also feel like they can be great models for each other and they really help each other find good vocab. So I have done it that way. My current district I work in, we don't do any of the RTI. So only if OT is on your IEP do we work with the kids and we work with them one-on-one. So that is what I'm doing currently. And I find it is really effective, um, but the carryover can be really tough. So it is really important to get buy-in with either the teacher or if you're an outpatient setting with the parents, because they need to be doing the body scan multiple times per day and really working on kind of that mindful attention. So if you're doing it in a group, I would just also have like the teacher be aware of it too, and have help them to find times in their schedule when they can do a body scan, or they could do one of the experiments for fun. And if you're working one-on-one, again to work with the teacher to help create some visuals in the classroom or on the student's desk and have the teacher help remind the student at the times when they should be doing the body scan. And then, do you have any recommendations for getting teachers on board for carrying over these strategies? This is definitely an area of challenge, and probably my biggest barrier that I encounter. The best way that I have found to get buy-in is asking the teacher to meet with me and kind of discussing how interoception affects everything. And once I'm able to talk about how interoception is impacting the student's ability to regulate their emotions and how that can be leading to some of the things we're seeing, like eloping from class or yelling out in class or sort of some of those behaviors, and I can explain how like the strategies I want to use and how it would look like in class. Once I can kind of get all of that information down, that is when I have found a lot of good buy-in from the teachers and from the adult staff that I'm working with. So I recommend doing that, kind of like talking about how um, like how this is what we're seeing in class, and that's the issue that I really like to work on. And this really great evidence-based program that I found working on interception can really help that. And just explaining like the time commitments and what's required of the teacher. So kind of reducing the time requirements for the teacher is also a great way to get buy-in. If there's a way to do a whole class, like body scan, that is also great. Most of the classrooms I work with have multiple sessions of like meditation and social emotional learning segments. They're like 5 to 10 minutes, and it's a lot of transitional times. So they do one after recess, after lunch, in the morning, after recess, after lunch. And so I've also asked teachers that during those meditation times, that maybe we can incorporate the body scan here. And so I've offered to kind of go in the class and explain the body scan to the main class, and then have the teacher kind of carry it out after that. So that has worked. But like I said, I think the reducing the time requirements and explaining the benefits of it can really be beneficial. And then I see, how do you effectively integrate these individualized interceptive supports into a student's IEP or 504 plan as a standard accommodation? I have always included them under sensory tools or sensory strategies. So when I'm writing an IEP accommodation, I'll put access to sensory tools and strategies to support regulation, such as, and then I'll put use of body scan, use of, fidget tools, that sort of thing. So it's included in there, because um, we can't really require that they do the body scan or that they do the interoception unless we have like an OT or a professional supporting them with it. So that's kind of how I integrate it. And then I have also presented this information to my OT team that I work with in my school district. So there's 16 of us. It's a pretty big school district. And so we all work on it together and we come up with some of the activities to do together. And so I also think a big team approach is great. And we do a lot of education learning on Wednesdays where we also educate teachers on different strategies they can use. So I don't necessarily write into the IEP that they have to do interception because it's not a curriculum requirement, but I do put access to sensory tools and supports and give that as an example.
Thank
I
you so much,
Of
Dr.
course.
Newman, for sharing with us tonight. And thank you, everyone, for asking those questions. Please use this contact information if you'd like any additional information, and you can contact us on social media as well. We appreciate you joining us tonight. The recording, slides, and your CEU emails will be shared next week. We are now going to transition to the closed professional learning community session for those OSEP grant mentors and mentees. Please remember, OSEP mentees and mentors, that we're going to use a separate Zoom link. We look forward to seeing you all at future events, and I hope you have a really great evening. Thank you.
Thank you, everyone. Have a good night.